Hi, my name is Chesney Missia, and this is my healthcare policy presentation on AI. So, as we know, AI is becoming such a huge topic in discussion in just so many different work fields, one of those being medicine. And in 2023, according to AMA, 2/3 of physicians, which is about 66%, use healthcare AI and is increasing each year. So what exactly is AI? So it stands for artificial intelligence, and it is really to stimulate human intelligence, but with the precision and accuracy of a machine. So current AI has not achieved full general intelligence, but they aim to kind of mimic certain human behavior like perception, reasoning, learning, language, and prediction. So I thought it'd be kind of important to talk about like the behind the scenes of how AI just generally kind of works. It's very, very complex, but I'm just going to talk briefly about the basics. So typical AI models are designed to detect patterns or in data using a set of complex math equations, and they can use these patterns to generate or categorize new information. So for example, ChatGPT, which is very common, they're trained on massive amounts of text data, and what they do is that they learn the common patterns and sentence structures of language from this data, and then they can replicate these patterns to create a human-like speech. So from this point, the developers can then provide feedback and refine the AI's response. So for example, a language model trained on text data might quickly learn how to write technical, correct English, but it needs to be able to guide and produce results that are helpful, factual, and relevant to the topics that are asked about. So all of that basically is saying that these models take a ton of data and they kind of recognize the different patterns, and then it can give you a response back based on what other people write and what the data says, but it's not always perfect. So how does this actually relate to healthcare AI? So like I said before, currently AI is used for so many different applications right now, for not just in medicine, but in other fields as well, because they can help with quick references, virtual assistants, navigation, finance, and so much more. So language models have a broad spectrum of generalized knowledge that makes them great assistants for those tasks. Now, like I said, AI is currently being used in healthcare in some places, but it's not widely used. But there's talk about using AI because these models can help with medical records, generating potential treatment plans, diagnosis, labs, and honestly anything you could probably think about. Because of how new AI is, there's just so much discussion on whether or not it's ethical and appropriate to use in medicine, because medicine is so strictly confidential, and this is like on a web base. That is a big concern, and I will go more into that later. So just a brief outline of what I'm going to be talking about. I'm going to be addressing the pros of using AI in healthcare, the cons of using AI in healthcare, how to kind of combat these issues revolving AI, and then how AI relates to healthcare policy and the PA profession. So like I said, there are many pros to using AI in healthcare. I found this article by Bordenham and colleagues, and they did a review of literature which revealed that there are benefits and challenges of using AI, but some of these benefits include reducing human bias if used correctly. It can also provide better patient care, reduce costs, and then another interesting application they mentioned was the possibility of using AI for cancer research and a potential treatment option. But then again, that is way far into the future and not really being done today. But I thought that was a really cool aspect to integrate. AI can also help with diagnosis, prognosis, medical treatment, and follow-up in patients. So I'm going to dive deep into this one article I found by Jian et al. And what they did in this article was kind of take the current status of AI applications in healthcare and discuss its future. So this article dives deep into popular AI techniques, including machine learning methods for structural data neural networking, and modern deep learning. They also touch on how it's being used in medicine currently, and not necessarily in the US, but in like other countries and they're using AI for cancer, cardiology, neurology specialties. And they did say like there are several advantages for using AI to help assist physicians by providing up-to-date medical information from journals, textbooks, etc. And they can also help reduce diagnostic and therapeutic errors that are inevitable to human clinical practice. However, in order for AI systems to work, they need to be, like I said, trained through data that is generated from clinical activities such as screening, diagnosis, and treatment assignments, so that they can learn similar group of subjects and associations between subject features and outcomes of these interests. So I took this image from the article that was used because I thought it showed like a good representation of how all this gets implemented into AI essentially, in terms of medicine. So all the data that is collected comes from patient demographics, their medical notes, any physical exam findings, and then clinical lab studies. And there are two different types of categories of like AI, which is machine learning and natural learning processing. Machine learning essentially analyzes structured data such as imaging, genetic, and other data. In other words, machine learning procedures attempt to cluster like patients' traits or infer the probability of the disease outcomes. And then neural language processing, or NLP, extract the information from unstructured data, such as clinical notes, to supplement the structured data. And essentially all this data gets coded and implemented to kind of get analyzed and give a answer. So this article did provide different medical scenarios on how AI could be used in medicine, essentially. However, these were not done in the US. But they did tailor these to different stroke studies, which I thought was interesting. And they essentially summarized the relevant AI techniques used in terms of early detection, treatment, and outcome predictions using AI. So as we know, stroke is most often caused by a blood clot traveling to the brain, but early symptoms are often missed, limiting treatment options. And to kind of address this one study developed a movement detecting device using genetic fuzzy finite state machines and PCA for early stroke prediction. And they did this by analyzing abnormal movement patterns, which was really interesting. Another different type of machine that was used was to predict and analyze the performance of stroke treatment. So we know that TPA has a strong relationship with prognosis and survival rate, and this is the standard medication of choice for stroke patients. So this study in particular used support vector machines to CT brain scans to predict the risk of systematic intracranial hemorrhage after TPA, to predict the outcomes and prognosis of patients who experience strokes. So, for example, there has been a proposed model also for predicting a 3-month treatment outcome by analyzing the physiological potential uses of medicine, which could be very beneficial in medicine. So with the pros, like I mentioned before, there are also many cons. Like I said, one of the main ones being that AI is so new and there are many unknowns to using this type of technology in medicine, or if we should even use this in medicine. But I think it is important to note the different cons that AI could have. So these are just a couple of different cons that I noticed. One of them being a huge one is patient confidentiality. Since AI is on the web, you never know what could happen. There could be breach, HIPAA violations, so many more other things that could go wrong. Also, there are ethical issues that could arise, as well as bias concerns. This meaning that AI could have a bias towards different patients, which can negatively impact a patient in practice. So it's important that we kind of find a way to combat this issue, which I will go into. The first con I'm going to dive into is patient confidentiality. And in this article by Burnham et al., their purpose in their research was to identify and evaluate the technical, ethical, and regulatory challenges related to the use of AI in healthcare. So regulating AI in healthcare is challenging not only at the national but also at the regional and international level. There are so many ethical and social risks that can come with the use of AI, such as maintaining patient privacy. So with that, this article in particular was performed by this author, where he collected articles from Google Scholar, and they focused on the use of AI in healthcare with particular attention to regulations, policies, and guidelines. One of the main concerns lie within patient confidentiality. Like I said, there have been numerous reports that patients' medical records have been shared or stolen. HIPAA is very important in healthcare, as we all know, and if there are confidentiality breaches, then this poses a huge lawsuit to the hospital. So that's really a huge concern. Another issue would be the data quality and availability. AI relies heavily on the ability to learn and perform certain tasks from large amounts of data. Collecting this large amounts of data comes with ethical and privacy issues, as you could probably guess. So if AI was to be used in medicine, this has to be really, really private and secure. So now I'm going to talk a little bit about the ethical considerations that could arise in using AI in healthcare. So this article by Talala et al. Provided a review where they explored the ethical considerations surrounding the use of AI and machine learning in healthcare, including the privacy and data, security, algorithm bias, transparency, and professional responsibility. So AI and machine learning algorithms have the ability to analyze vast amounts of data, like I said, including medical imaging, genomic sequences, EMRs, and just many patient-specific items. With that, because AI is considered an open source, this raises a lot of significant concerns. One ethical consideration in AI is privacy and data security, and while we currently have many ways to protect patient information, AI has the potential to incidentally expose patient information because it is still new and there aren't many safeguards regarding AI. So to ensure this, data security protocols must be implemented throughout AI machine learning life cycles, and from this data acquisition and stooge to algorithm development. Additionally, ethical review and oversight should be established to evaluate the ethical implications of AI and machine learning projects, to assess the risk of these patient privacy and ensure that these ethical standards are upheld throughout the development process. So it's very important and imperative that healthcare organizations are transparent to patients about their data for AI by providing them with potential risks and privacy safeguards. So lastly, I'm going to talk about the bias concerns that revolve around AI and its use. So like humans, they are susceptible to bias, which include racial, sexual, and socioeconomic biases. And this can be due to skewed training datasets that fail to represent diverse patient populations. This potential bias could lead to disparities in diagnoses, treatment, and outcomes among the different patient groups. So for example, there are some racial populations that don't have a lot of medical data, so therefore the AI algorithm can be skewed a certain way. Lastly, another important ethical consideration is patient or professional responsibility and accountability. So in practice, AI algorithms streamline medical analyses and decision-making by processing large amounts of data quickly and identifying patterns. However, there are some concerns with this method because AI may not always be accurate. ensuring the validity, and each recommendation requires like a clinician to perform some of the same mental tasks as a normally would. So some ways to combat these issues that I just addressed, I think it's important if AI were to be used in healthcare and integrated in healthcare policy, it'd be beneficial to kind of talk about the ways to prevent these cons that I just talked about. So in terms of patient confidentiality, I think adequate training and education is very important. Using a VPN and authentication system would be very beneficial to kind of prevent those possibility of breach of patient files, or just having the files be exposed to the world essentially. So having that authentication system ensures the lockdown and only certain people can get into those files. With the bias issue, I think it'd be important to incorporate data from underrepresented groups, employing data augmentation techniques to address imbalances, and collaborating with diverse stakeholders to ensure the inclusivity of data collection efforts. Also, fairness-aware training algorithms could be helpful in this situation as well. So all this really is saying is that we should incorporate data from all walks of life and not just a certain type of demographic or sex orientation or socioeconomic status, essentially. And then in terms of professional responsibility, questioning the algorithm, seeking additional clinical evidence or consultation, and advocating for patient interests would all be helpful to combat this issue. So how does AI really relate to healthcare policy? Well, if AI were to be used in medicine down the line more frequently, like specifically in the US, it's important that policies need to be made on how to use AI correctly and how to regulate AI to prevent kind of some of the cons that I mentioned, one of them being data privacy and security. So training and using AI in healthcare relies on large data sets, often involving personal healthcare information, and it's really important that AI, if hospitals were to use AI to kind of make a system to prevent some of the breach issues and then patient confidentiality with their health information. So incorporating HIPAA and other privacy laws is very important and imperative to prevent lawsuits and many other things. Also, the workforce implications. So AI could automate some of the healthcare tasks down the line, such as radiology techs, administration, and scribes. It's important that the policy can consider defining the roles and responsibilities for humans versus machines. So I thought this study was pretty interesting, and it relates to kind of more of the healthcare policy making aspect. So the study by Ramazani, what he did was he did research on AI's application and capabilities in healthcare policy making, and he just did a web search of using PubMed, Scopus, Web of Science databases, and he found articles, and 90 of those articles he found fit the inclusion criteria. And some of the results that he found was that they highlighted the value of AI for policymakers to track performance indicators such as mortality, morbidity, and life expectancy. And if these technologies were implemented correctly to evaluate AI in healthcare, then it can improve the efficiency of the entire healthcare system. And then the article also argues that this can be done through AI's advanced ability to perform automated analysis, evaluate policy, predict, estimate, and forecast health outcomes, and even environmental factors. Lastly, I kind of wanted to discuss how AI and healthcare policy relate to the PA profession specifically. So, like I mentioned before, one of the big benefits of using AI is to help with charting. This is actually being done at my sister's hospital. She's a PA, and she told me that they have this app on their phone where they can essentially use AI, and they go into this app when they go into the patient counter, and this app can record their whole entire conversation, and as soon as they're done with their encounter, it can put it into a SOAP note or their chart system. Obviously, there's some flaws with that. It's not perfect, but she said it's very helpful and very efficient, so I thought that was pretty cool. And another reason is that the AI can help with clinical decision. So AI tools like diagnostic algorithms, risk prediction models, and clinical documentation can help with the decision-making process. Obviously, the PA needs to really know their clinical and medical knowledge, but kind of having that quick reference backup for AI, using AIs could help in the long run. Also, education and training. PAs will need digital health literacy, meaning they need to know how AI works and how to navigate the system, so understanding its capabilities and limitations is very integral if AI were to be integrated into a healthcare policy. So in conclusion, while AI shows great potential, there are many pros and cons regarding the use of AI in healthcare. We also talked a lot about the pros and cons with using AI. Pros meaning it can be very efficient in charting, it can help with diagnosis and treatment, and many other different tasks. Cons, we talked about patient confidentiality, bias, and ethical concerns regarding AI. Then we also talked about how AI relates to healthcare policy and how AI relates to the PA profession as well. And here are my references.